Hello and welcome to the complex or composite scenario. So here I'm trying to make multiple changes in the process to see, what the impact of that is going to look like. So the setup here is one that has lighter BMI patients going to track A, heavier BMI patients going to track B. I'm going to make a whole slew of changes here and just run them all together. Now, you may have to put together subsets of changes and perhaps changes that are outside the ones that have been considered in the playlist. But I'm going to go to 120 on the arrival times. So that was something we investigated in the Psychology Matters clip. I'm going to pool the anesthesiologists, and I'm going to add I'm going to put 3 in there. I'm just adding 1 anesthesiologist, but I am pooling the anesthesiologists. And when we seize that anesthesiologist in track B, we're going to be seizing from pool A, because that's the only one with any anesthesiologists in it. So 3 of them there instead of the original 2 that we had. So let me just try and resize this to add. For some reason it got bounced pretty far across here. Not sure quite what's going on there. Let's just try and go back to main. Okay. It's a little odd. There it goes. Okay, simulation main. Okay, so there it is. All right, so we've got our slower arrival rate. We've got our variance reduction change implemented. I've now got 3 anesthesiologists in Pro A, and I've changed the where we seize those folks. I'm also going to pool all the ORs. So let's do that. So I've implemented the pooling idea. I've implemented the variance matters idea by adding some anesthesiologists. Now you could do 4, you could do 3. I'm just choosing to do 3. And I think this is what I want. I do need to implement this seizing of the OR as they're only available now in pool A. So when I do seize here, I want to seize from ORA. Just try that again. So we're going to grab from upper room pool A. Okay, let's see if this will run. Again, you need to do 3 to 5 runs to estimate performance. Maybe you don't agree with some of these, but let's see how they go. Okay, so I'm going to just immediately run this to max to see how many surgeries we get and how long the flow time is. Put that in red. Let's go to the end. Okay, so I got 4 surgeries here. I got 4 surgeries here also. It looks like there's only 3, but this is a stacked bar, so there's 2. Now, I'm seeing pretty decent numbers on the patient flow times, 122 and 148. My anesthesiology pools at 76%, 77%. My surgeons 76%, 70, so about the same. So it seems like it's a tie here, more or less. I'd have to do more work to get better estimates, but it seems like the anesthesiology pool is about the same utilization as the surgeons. And I never investigated the surgeons as sort of available for any innovation because of their prior consult. The patient has to see the surgeon that they've consulted. Okay, doesn't look like adding ORs is going to help. And it doesn't look like adding additional anesthesiologists will help. So, from the perspective of where we are now, I would say, yes, I can help you out with innovations that are going to improve the customer experience by dropping it from whatever it was in the base case down to these numbers you're seeing here, and I'd have to get better estimates from multiple runs. Let's try one more run. Just go down here and change that. Here it comes. What it's doing here. Acting up a little bit. Seem to have lost my main. Close some of these. Let me close that as well. There it is. Okay, and then I want main. So keep everything else as is. And change your seed here just to some other number. Let's go with 2. Again, I'm doing the replications because each of these is sort of a day in the life of this surgery process. And because of the variety of customers that are coming at it, these experiences can be very different. So the number of completions, the service, the flow times, and so forth can be very different. That's why you need to kind of look across multiple days to get a sense. So 120, looks like 128 and 137 on the flow times. I got 4 and 4. So I'm not thrilled about how many surgeries I'm getting, but I am getting lower flow times, and dropping it below 120 would seem to be risky because now the flow times are about in that ballpark, just 8 minutes difference in track A. So I think my last question would be here, are there any process improvements that we could effect? This does split the patients into lower and higher BMIs. Is that a good move? I'd have to test that now. And then the question is, what else could be done? I know that in private practice, the surgeons are able to move faster. So is this training, the experienced surgeons to train the residents? That's what is at issue here? Is it just sort of ineffective teaching, or is there still something related to the surgical process that I could reduce the time on with some innovations? For example, standardized tooling, maybe better training. You could look across the different surgeons, more and less experienced, although they are academic surgeons. There will be variations in experience and ability there, and maybe there's some lessons. So just looking at performance across the group and looking to leverage any insights, there could be something that's useful. Now, one of the ways to make a recommendation here, we're at 4 surgeries, at least on this particular run. So the question may be, one thing maybe that's worth reporting would be to look at your mean surgery time that's listed here. So right now, of course, I've split it up into the lower BMI and the higher BMI, but it was originally, I think, 100.71 or something. How far down do you need to go to get a 5th and a 6th surgery? I think that's an interesting number you could report, and you could say that you're unable to get, the number of surgeries that are wanted, but if the mean process times were to drop to, the specified level that you find, then, the 5th surgery becomes possible. And you could report it that way. Maybe it's not achievable, for whatever reason, but at least, the administrators and the decision makers would know where the process needs to go to generate that 5th and maybe 6th surgery. Okay, so this is, the composite scenario. We've looked at this hip-hop case from the perspective of utilization matters. pooling matters, psychology matters, and variance hurts. Those lenses allow you to look at business processes in general, come up with proposals for innovations, and then in settings where queue lengths, flow times, and so forth are important, you can use queuing and simulation tools to make those assessments, and use that to motivate your recommendations. Hope you enjoyed all this.